Hello, everyone. Hi, everybody. Very happy that you're all here for this very important topic. So we're going to talk a little bit about the peripartum mood disorders, which is something very, very common, as you all know. So I'm going to go a little bit through, explain a little bit of statistics about these disorders, um, how do we diagnose these, many risk factors, and a little bit about treatment for this. So it's going to be a little bit medical, but I'm going to make it, simple, in simple terms. And as Danielle was saying, you can think about your questions, and then we can take some time after to answer them. Okay? Okay. Hope everyone is able to see the slides. Okay. Okay. So as I said, this is something very, very common. 1 in 5 women, meaning almost 600,000 per year, suffer from some type of peripartum mood disorder, and 1 in 10 men. We often don't think about men suffering from this, but it's also common in fathers. Unfortunately, less than 15% receive appropriate treatment. So it's still a very a major barrier accessing mental health for these patients. We're going to talk a little bit about screening and the common term that we all know, which is baby blues. Okay. So what are the risks of not getting appropriate treatment for this postpartum or peripartum mood disorders? There's side effects or bad effects on the baby, like growth retardation, low weight, preterm birth, a risk of a baby spending some time in the NICU. There's some neurological and behavioral problems in the long term. There's increased maternal morbidity and mortality. There's impaired baby and mother bonding, low quality of life, low success in breastfeeding, and something that is very risky, suicidal or homicidal ideation. We all have answered these questions, right? When we're pregnant and in the postpartum period, we have answered these screening questions at the OB office. This is what is called the Edinburgh Perinatal Postnatal Depression Scale. Okay, and this is one of the regular depression scales that we use. And, they ask about symptoms of depression. They ask about somatic symptoms. They ask about how emotional have you been and how have you been able to handle these emotional issues. On this second screening, okay, they also ask about things like appetite, sleep, or oversleeping, or increased appetite, lack of energy, poor concentration, and in general, how is your ability to cope and function when you have these symptoms? Okay, there's some risk factors for peripartum mood disorders. So, of course, if you have history of depression, anxiety, or OCD in the past, you are more at risk of suffering more severe symptoms in this period. We always check patients for medical issues that can interfere with your mood, thyroid problems, diabetes, other endocrine disorders, lack of support from family and friends, pregnancy or delivery complications, infertility, miscarriage, infant loss. If you have premenstrual syndrome, that will also put you at more risk of experimenting these mood disorders in the postpartum period. Financial stress or poverty, history of abuse, and unwanted or unplanned pregnancy. Okay, talking a little bit specifically about the conditions or these mood disorders. So we have depression, which is the most common, what we call the postpartum depression, anxiety disorders, we have panic disorders, we have OCD, obsessive compulsive disorder, we have PTSD, post-traumatic stress disorder, We have other disorders we psychiatrists treat very often, bipolar disorders and perinatal psychosis. Okay, so now talking about postpartum depression. These are some of the symptoms that you experience when you are depressed. Okay, feelings of guilt, shame, hopelessness. You can feel really irritable or angry very easily, and you have a scary or unwanted thoughts. You have a general lack of interest in the baby or difficulty bonding. This is very important. We always ask about this. Loss of interest, of joy, or pleasure in the things that you used to enjoy. Poor sleep and appetite, crying, sadness, constant worry, racing thoughts, and you have also physical symptoms like gastrointestinal symptoms, dizziness, nausea, and the possible thoughts of harming the baby or yourself. So what is baby blues versus depression? Okay, so baby blues is a term that has been used for so long, and is basically the adaptation and the stress that you feel as a new mother in the first 2 weeks. Is something that is temporary, right? That is almost all new mothers experience, about 80%, but it doesn't really affect your functioning. You are still able to function, take care of yourself, take care of the baby, and kind of adapt to the new situations. And the treatment is basically support. You can also have some additional therapy, but it's something that it gets better with time, okay? As opposed to depression, the postpartum depression, up to 20% of new mothers experience this, and it can last long time, from weeks up to a year after giving birth. And what is more concerning is that really impairs your functioning, right? You don't feel like yourself. You cannot function like you were functioning before. And it can be so severe that you can feel suicidal. Okay, so the treatment in this case, of course, is social support and therapy, very important. But when someone is experiencing depression, we also consider medications. So we're going to talk a little bit more in detail about that. More criteria or symptoms of depression: you feel empty, you feel hopeless, you feel basically sad most of the time. You don't enjoy things, as we talk about. You feel guilt or worthless. You have very decreased energy. You feel physically very tired. Your concentration is decreased. You have appetite changes, either is eating too much or not eating enough. You have psychomotor changes, again, the fatigue, sleep changes, very poor sleep, which is also, of course, affected by having a newborn, and suicidal thoughts or behaviors. This is very, very common. I would say even more common than depression. And it's the anxiety, it's the extreme anxiety and worry that we experience with as new mothers, right? So what is anxiety? Something that it can be temporary versus what we call generalized anxiety disorder. Okay, so anxiety is normal, but of course we're gonna be anxious about having a baby, about how to take care of a baby. It's a new responsibility, new routine, but the normal worry doesn't really affect our activities or responsibilities. You are still able to manage and cope, right? You are able to control the worries, okay? The worry doesn't cause significant distress, and is limited to specific things and that are realistic, like, for example, baby being sick, baby gaining weight, baby sleeping, baby crying too much, baby being vaccinated, things that, of course, are realistic and are going to worry you as a new mother. Okay, these bouts of worry last a short time. Okay, again, as opposed to suffering from a generalized anxiety disorder, which significantly affect your relationships, your social life, your activity, your work life. The worry is uncontrollable. You have a very hard time trying to control the anxious thoughts and feelings, right? The worries are very upsetting and stressful. And the worry is about all sorts of things. It can be about every little detail in your life, right? And you tend to have pessimistic expectations about everything, right? When we diagnose someone with generalized anxiety disorder, we obviously ask for how long have you been experiencing the symptoms, and patients often say that this has been going on for months. Okay, so if someone has been experiencing this for at least 6 months, we can say that they're suffering from generalized anxiety disorder. Okay, so again, when we interview someone and screen for a more serious anxiety disorder, we ask about all these things, about your sleep, your ability to concentrate, feeling restless or constantly tense or on edge, right? Feeling very tired, very angry or irritable, and having that muscle tension that we often feel in our neck and shoulders is constantly feeling tense and on edge. Other very common symptom is OCD, the obsessive compulsive disorder. Okay. As new mothers, we tend to, of course, keep checking more, and we tend to overthink things a little bit more, right? Okay, so in OCD, we have obsessions and we have compulsions, okay? So this is something that basically consumes your life when it's a disorder, okay? You have these intrusive thoughts, okay? And they are so stressful that you have to do something to control those thoughts, okay? And that's when the compulsions come. The compulsions come trying to do a specific activity or action in order to control those thoughts, okay? So some of these compulsions or obsessions are normal, we can say, especially after having a first child, but they don't cause severe impairment. So we go back to, again, how well are we functioning and how well are we coping with this, right? So we constantly tend to check the baby when he's sleeping, make sure he's breathing, make sure he didn't move, make sure he didn't throw up after breathing.
Choking.
Right? Choking is something that is very, very stressful and is, constantly in your minds, right? So yes, there will be some normal checking behaviors and recurring thoughts that we get, but it won't consume your life, right? You're able, again, to cope. When you have an OCD disorder, it's basically consuming your life. And as we say, one of our criteria to diagnose this condition is that you spend a lot of time going through these thoughts and these compulsions, right? It usually takes the form in germs, right? Germophobic and specifically having a routine, having an order. There's other intrusive thoughts that, may contain some sexual or violent thoughts, often without the behaviors, okay? And you can have one or both, right? You don't have to have two in order to be diagnosed with OCD. Bipolar disorder is something that psychiatrists we tend to see very often, and is this extreme mood changes, okay? In the general population, people tend to call other people, oh, you might be bipolar because just one minute you are angry, 1 minute you are okay, and then your minute you are depressed. But as a psychiatrist, we go a little deeper, and we understand that these changes in mood are really severe. Okay, they're really severe, and it's not from 1 minute to the other. It's something that lasts days. Okay, so these mood changes can go from a very depressed to a very hyper anxious and hyper energetic state. Okay, so when you are bipolar or you become manic or hypomanic, you're very distracted, okay? Of course, the first sign is the insomnia. You sleep very, very little, and still you have a lot of energy to do things. You feel a little bit grandiose. You have a lot of thoughts coming at once going through your mind, and you are very energetic and are able to complete a lot of activities in very little time. Okay, you talk really fast because your thoughts are going so fast to your mind that that's the way you speak, right? And you become a little bit impulsive. Okay, so we know that bipolar disorders are very much related to the most severe mood peripartum condition, which is the postpartum psychosis, okay? Which is a psychiatric emergency because there's a very high risk of suicide or infanticide, okay? So fortunately, this is something that is not as common, but when patients suffer from bipolar disorder, they can present as psychotic in the postpartum period. Okay, so when we have someone who is depressed in the postpartum period, we always kind of want to rule out any type of bipolar issues in the past. Okay, so a patient who's suffering from psychosis in the postpartum, peripartum period, they tend to have a very flat affect. They isolate themselves. Okay, they are kind of very slow and impaired, obviously, and the reality testing is impaired. Okay, this is when strange thoughts come to play as delusions or even hallucinations. Okay, so patients start to hear voices that are very scary to them, and they have a fixed idea that is very different. Okay. We can talk a little bit more about that if you have questions, but again, this is a psychiatric emergency, and we always ask about hallucinations or strange thoughts and feelings and behaviors from family members when we evaluate someone with postpartum, peripartum mood issue. Okay. PTSD. So what is PTSD? PTSD develops when you are exposed yourself or witness a very serious injury or illness or a near-death experience or violence, right? And we always ask in our interview about these symptoms, being constantly like in a hyper-arousal state, right? Very hyper-vigilant, aware of your surroundings, very distracted, you have problems sleeping, you are really trying to avoid the memories or the triggers, of course, and because you're having these intrusive thoughts about the trauma. You have these ruminating thoughts and memories about what happened and what you witnessed or experience. You have nightmares and you have flashbacks. You have negative mood symptoms. You're feeling kind of detached. Again, anhedonia. Anhedonia is the lack of pleasure, right? You don't enjoy things that you used to do before, and you're very fearful, and you try to isolate yourself, and you have a tendency to blame yourself about what happened. Okay, medications in pregnancy, okay, and lactation. So things have changed in the past few years, okay? A few years ago, if you ask a pregnant mother or a breastfeeding mother about taking psychiatric medications, it was an absolute no, right? Even doctors were very scared about even talking about medications, and the idea was stop medications and just wait until you have the baby and don't breastfeed if you want to think about any type of psychiatric medication. So things have changed, okay, from many studies. We're going to talk a little bit about this. And just the first point here is 50% of pregnancies are unplanned, right? So when we have in our psychiatric clinic, when we have a young woman with mood disorders, we kind of think about the possibility of being pregnant or getting pregnant. And we try to avoid some medications like Depakote is basically one of those no medications in pregnancy, right? So we think about that when we follow young women, okay? But there's many guidelines that have come over the years that they have very good sources about the possible risk of medications, psychiatric medications in pregnancy. Okay, so as I was saying, the early studies years ago were a little bit, not too uh, made like with a good sample and good sizes of all these patients, and they lack proper control groups. So it was not as reliable as we did it after. Okay, and it was a high risk at the time of under-treating these conditions. Right, we have a lot of patients even not even talking about the way they feel because they know that there was basically no hope, right? Just kind of wait it out and hope to feel better, but they were not thinking about taking medications. Now, the other point that I want to make, if you have a psychiatric condition and you're doing well with a medication and you become pregnant, don't change it, right? That's a rule that we have unless it's one of those medications that we want to avoid, which are very few. In general, antidepressants, okay, antidepressants are called, you heard these names, SSRIs or SNRIs. There's other antidepressants, okay, and these are some of the most common names that people have used. Like, for example, sertraline, we use a lot, is very safe, very low risk of side effects, it's safe in lactation. Paroxetine or Paxil, we kind of avoid because it has a slight risk of having a cardiac malformation in the first trimester. There's other medications like venlafaxine, Effexor, bupropion, Wellbutrin, mirtazapine, Remeron. I personally use also. It's very good for sleep, appetite, anxiety, and it has low risk, even though the data is not as robust as the other medications. SSRIs, they're called antidepressants, but people don't realize that this is also the first line of treatment for anxiety, for panic disorder, for OCD, for PTSD. So a lot of people ask, well, I'm not depressed, so why are you giving me an antidepressant? So no, this is a medication of choice for a lot of anxiety disorders, okay? Okay. Now, what if you suffer from bipolar disorder or psychosis or other chronic mental illness like schizophrenia, schizoaffective disorder? You may need an antipsychotic. Okay, and even antipsychotics, what we call the second generation antipsychotics, they are considered low risk in pregnancy, so you can continue your antipsychotic. Okay, as far as mood stabilizers using bipolar disorder, again, the only one that we really try to avoid is Depakote, okay, because it has some bad effects on the baby. Lithium, a lot of patients are on lithium too, and there's a low risk of having a cardiac abnormality, which is called this Epstein anomaly, okay? But lithium is a great medication and it can be life-saving. We use it in patients who have tendency of suicidal ideation. And we just need to monitor the levels and monitor the kidney function. Okay, there's other more stabilizers like Lamictal is one of the other more common. It also has a lower risk in pregnancy. We may need to adjust the medication during pregnancy, and we just need to provide, folate supplements, which all our prenatal vitamins have. So these are the most common medications that we use, and as I said, they're generally safe. I think that's all for me. As far as medications, I always tell mothers that it's riskier to have a depressed and anxious mother than taking a medication, right? As it carries more risk to you, to the baby, to your general functioning, to stay depressed and anxious, as opposed to take a medication, which is a very low risk. Okay, I think that's all for me. So now Terry's gonna talk a little bit about what to do, what can you do, when to ask for help, And how can you feel better?
Yes. Hi, everybody. Thank you, Dr. Fan. That was really good. A lot of good information on there. Yes, I've been running the new mom group for the past couple of years, and I've also met with many patients in the hospital after they have a positive Edinburgh, even after birth. Typically, that would be the first time maybe somebody is expressing, a new mom is expressing maybe that she's feeling anxious or like nervous about um, the baby. Maybe she was feeling that way even during the pregnancy. There's a lot of things to be worried about. A lot of doctor appointments, just, a lot of moms hear stories from other mothers about their delivery. It can be really scary coming in just to deliver the baby. So hopefully things go well in the hospital, the delivery goes well. If there's a NICU experience, if there's a traumatic birth, even if breastfeeding is something they plan on doing and it's not going well, they can really start to feel anxious almost like day one after having the baby. It's hard to know how you feel really those first 2 weeks, which is why we call those baby blues the baby blues. And a lot of times you're not, well, most of the time you're not sleeping well, especially if you're breastfeeding. And exclusively breastfeeding too. Like even family can help with the feeds at night. Babies can develop like reflux or, sensitivity to the breast milk or to formula. So there's a lot of unknowns and there are a lot of things to be worried about. So hopefully, like if there's support, whether you're a single mom or you have a husband or a partner, family support, that's one of the things we always want to ask about first, because that practical support is most helpful. Just getting a break for the baby, taking some time for yourself, lowering your expectations. Like I would tell moms, like keep your expectations like real low because you're much happier than um, you know, trusting your doctor, trusting your pediatrician, seeking reassurance is always helpful. But for somebody who's very anxious, the more they seek reassurance, it helps in the moment, but then it creates more anxiety at times. Like you call the doctor, and then maybe you feel good right then, but then yeah, you want to call again. You just keep wanting more and more good reassurances, even like checking the baby at night. Sometimes moms are embarrassed to say how anxious they are, or that they're not bonding with the baby, that they don't feel this love affair at first sight that they thought that they would have. There's so many thoughts and feelings that go on with new moms that are really normal, and the support of other mothers helps a lot. Like the group is really good. Going to Danielle's group, the lactation support group at Valley's excellent. I think just kind of knowing that you're not alone in struggling with a lot of these fears and feelings that you're having, or it helps to know that you're not going crazy, that you are a good mom. I always tell the moms, like, you are the perfect mom for that baby. There's nobody else who's better for that baby than you. So, just doing the best you can. But seeking therapy is like when it's often a struggle to know like when is a good time or do I actually need therapy? And I see many moms here in the clinic, and we do really good work in here. They improve very quickly, and a lot of it is just like talking things out, lowering again their expectations of themselves, taking time for themselves, take a walk, even if it's going to have a cup of tea by yourself. Like it doesn't have to be like a big spa day or anything like that. That's great if you can get that, do that. But just little things, so that you're not burnt out and overwhelmed with taking care of the newborn because they are very demanding people. So I don't know. I don't know if anybody has any questions about anything. Danielle, are you?
Yes, hi. This is
Oh, okay.
incredible. Both of you were incredible to listen to and hear. Um, If anybody has some questions, please type them in through the chat and I'm happy to facilitate reading them. I do have a couple of questions. So what is a sign to you that I should be seeking professional help? When would you tell a mom, yes, you should call us or call some sort of a professional to speak to about your postpartum anxiety or depression or whatever it is?
Well, I would say, I think if you're crying a lot, like a lot of moms experience like tearfulness like throughout the day, and they just aren't able to be in control of their
Mhm.
emotions. They're not sleeping or at all, or very little, despite having the opportunity to sleep.
Right.
Like being very anxious. I should be washing bottles, I should be doing things, even if their family's saying, go take a nap, you need a rest, and they just can't sleep. Feeling down about how they are as a mother, isolating, often like even like handing the baby off, like feeling as though the baby would be better off with somebody else feeding or caring for her or him because they're not doing a good job. Um, really like where it's really affecting their ability to function and enjoy the baby.
Right. I think that's the main message, right? That you are not able to go about your routine, right? That is getting so difficult to go through the day, basically.
Mhm.
If it's getting too difficult, that's when you know that you need extra help.
Great, thank you. Um, do you recommend any natural supplements for postpartum anxiety or depression?
You know what? Sleep is very important, right? And that's one of maybe the first thing that goes away even when you're pregnant,
Mhm.
right? So yes, I use melatonin. I recommend my patients melatonin, right? Melatonin is not a sleeping pill. People believe that it will be like a switch, like to put you to sleep, but it kind of mimics the natural hormones that we have, which is a natural hormone, and kind of set your brain to relax. That's what it does. So it will be a little bit easier to relax. Okay. I recommend melatonin. I recommend magnesium. It has to be a special magnesium, magnesium glycinate. I recommend to patients who are kind of tense or worried or have problems sleeping when they can. So those two things I recommend. Okay, along with a good diet. So in patients who suffer from anxiety and depression, very important to do probiotics, very important to do good omegas. Okay, if you are not getting that from your diet, I will say to supplement that.
Great. What are healthy ways to manage stress and anxiety as a mom?
Well, one thing again, checking your nutrition, make sure that you are eating well. It doesn't have to be, special meals 3 times a day, but at least eating throughout the day, something that is very healthy and avoid high sugar intake and exercise. I think exercise, well, you don't have to go back to the gym and be in shape and start losing the weight. No, but at least go for walks. At least if you can, being active is very, very, very important.
I tell the moms GPS, get outside, protein, sleep. Those are the three things that are most important right now.